Hi, I'm Carl.
And I'm Shane.
And this is Angelica. Welcome to Pause for the News.
In Pause for the News, we examine social issues and current hot topics surrounding our companion animals.
Heel, fetch, sit, stay. I'm good all day, doing what you say. You're my best friend. There's time to talk and there's time to walk. We're going off leash. I'm gonna run, run, run. I'm going off leash. I'm gonna have some fun. We're going off leash. I'm gonna chase that thing. We're going off leash. I wanna hit the beach. We're going off leash.
Welcome to Allendale Veterinary Hospital. This is our reception area. We have a greeter who stands here at the station and gets your name of your pet. While you sit for your appointment and wait, you can enjoy the ambience of our lovely saltwater fish tank. Help yourself to a coffee and cookies. In the winter, when it's cold, we do have the fireplace on, so it's kind of nice and warm to wait while you're here waiting for your appointment.
And here we are at the Allendale Veterinarian Clinic in Barrie, Ontario. Angelica is going to go through a spaying today. It's this period of time. She's at 6.5 months of age. And our little co-host Angelica is going to be spayed for many reasons. And we're going to be speaking with the veterinarian with regards to those reasons. Sadly, what happened though was that just about 5 days ago, Angelica actually went into a heat. And for you to recognize what a heat is, I'm just going to move her around. That's okay, Angelica. Good girl. Now you'll see her behind area, the swelling there. And that's an indication. Also what's happened, however, though, is that Angelica has been spotting. And the other thing for you to take a look at is her, the little, what they'll call titties, or what I would refer to as the nipples. So they're very pronounced. Now there's controversy, or there has been controversy, whether or not you actually spay a pet when they've gone into heat. Probably my generation and the majority of people that I've been speaking to, they all felt that I shouldn't actually spay Angelica during the process of this heat. But we've learned some further information, and it's a routine operation, and we're going to find out more. And I'd like to introduce Dr. Lecton at the Allendale Veterinarian Clinic in Barrie, Ontario. Dr. Lecton, I understand you're going to perform this procedure on our co-host here, Angelica.
Yes, absolutely.
I've got a quick question though, because it's a little bit controversy. Whether or not you spay a pet or not when they've gone into a heat process. And maybe it's just from my generation or some form of...
Honestly, I think it's more veterinary preference. Okay. Some veterinarians, there is the potential for a little bit more bleeding, and some veterinarians are very bothered by that. Others aren't. I don't find it so extraordinary that it creates any issue as far as I'm concerned. And the other thing is, if she's in heat, she may still be somewhat attractive to males even after she's spayed. So you just want to be cautious with her for a week or two. I wouldn't throw her out in the yard by herself, but you're probably not going to do that right after she was spayed anyway.
No. She's going to be very well protected.
I'm sure.
Now let me ask you, Dr. Lecton, also another issue that I've heard out there, and this is where we'd like to correct it for our viewers, is that if you spay a pet during this heat process, it can mess up their hormones.
I've never seen that as an issue. And I have occasional breeders that spay at the time of doing a C-section. So they're pretty resilient. It's rarely a problem.
Okay, so it won't change your
ever.
temperament?
No. Oh, no.
Okay, so we need to correct the understanding out there to our viewers, and this is very important information because a lot of people will wait for that period of time until after the heat. So, well,
Which
thank
is
you.
unpleasant for everyone.
Yes.
We always do a physical exam prior to any anesthetic, even if we saw the dog last week, just to make sure there's not anything we need to be concerned about. One of the big things we're looking at if they're going to surgery is, are their gums nice and pink and happy looking? They don't look anemic or like there's any problems there. Just checking the eyes. Sometimes even in young dogs you'll find cataracts or abnormalities. She's very pretty. And we check their teeth because sometimes, especially in smaller breeds, they'll have baby teeth that won't fall out. And when they're under anesthetic for their spaying is a good time to get those out of there. You don't want to leave them. They tend to develop tartar around those teeth. Hers are great, no baby teeth left, but just something we watch for.
And what are you listening for now? Her heart?
Her heart, we want to make sure that there's no heart murmurs. Wouldn't mean she couldn't have anesthetic, would just mean we would alter the type of anesthetic we gave so it would be as safe as possible for her. And make sure that her lungs sound clear, that there's no reason to be concerned about her breathing. And she is wonderful.
So she's getting sleepy now.
Yeah, this won't completely put her asleep, but it's just going to take the edge off her. So she's not going to, there we go. So she's not going to give a lot of care much. Okay, let's see.
Good girl.
That's a good girl.
Good girl. Good girl. Good girl,
So
Angelica.
now she's sleeping. I'm going to attach her to this hose. And now she'll be breathing in a gas anesthetic, which will maintain her plane of surgery there. All right, so now we're going to prep her up here. On her belly. Nathan's going to shave her up there. The next one will be an alcohol and then an iodine finish. And here comes the alcohol. Good. And we'll finish the last part.
So the area's been shaved and scrubbed with an antiseptic solution and then some alcohol to help kill any bacteria, and then a final prep of some betadine to make the area as sterile as possible. Dogs have a uterus with a body and then two horns. So I pulled out the first horn. This is the ovary here. The uterus is a bit bigger because she's in heat right now. If she were young and not in heat, it would look almost like a large string. In dogs, when we spay them, at this point in time, we do a complete ovariohysterectomy. So we remove both ovaries and the body of the uterus. The main point of the spaying in dogs is so that they don't go into heat and so they don't have puppies, but also removing the hormones helps to decrease certain cancers such as mammary tumors later in life. There is some thought that, especially with larger breeds, it's a good idea to spay a little later because having hormones when they're young isn't a bad thing. So larger breed dogs we try to spay closer to 8 or 9 months, and there's some thought about spaying them after their first heat, though you have to weigh the risk of them getting pregnant against the earlier spaying. We just tie off the blood vessels so that we won't have any bleeding. And what's left behind is just the remaining tissue, but no ovarian tissue. And then there's the second uterine horn. So in a dog that had puppies, their puppies would live up in the horns. And the uterus will expand to 10 times the size or more. And Angelica received pain medication prior to her anesthetic, and she'll have additional pain medication that will go home for the next 5 days or so. And a lot of times dogs tend not to show as much pain as people, or owners will say, well, they're acting absolutely fine, can we discontinue the medication? But I suggest giving it as long as is directed, because they may be acting absolutely fine because they're getting pain medication. There's a larger blood vessel that runs up each side of the uterus, so it's really important to make sure that that's tied off well. And though there's always exceptions, the majority of dogs that are spayed have very little bleeding. Sometimes especially if they're in the middle of their heat, it makes the tissues a little more friable. They'll tear a little easier, and that's another reason why some people are less inclined to spay in heat. But I find as long as you're cautious, it's usually not an issue. So, that is Angelica's surgery.
Wow, that was very quick.
Lisa's turned the anesthetic off. She'll still be asleep for a while because the injection she's received will take a while to wear off. And we'll continue to have someone monitor her as she's waking up.
Okay, so we're back. We had to leave for a few hours, and a little anxious to see our little Angelica again. So I understand she's about to come through the door any minute. So I think she'll be happy to see us too. Okay, here she is, Shane.
Angelica.
Hey, what's that?
Hi, Angelica. Hi. Hi, baby girls. Aww. I know.